is Erin Hayes, and my chosen topic is structural racism in the healthcare system during COVID 19. Structural racism is the normalization and legitimization of an array of dynamics, historical, cultural, institutional, and interpersonal, that routinely advantage whites while producing cumulative and chronic adverse outcomes for people of color. It is a system of hierarchy and inequality primarily characterized by white supremacy. The treatment, privilege, and power for white people at the expense of Black, Latino, Asian, Pacific Islander, Native American, Arab, and other racially oppressed people. Once COVID 19 was added to the already occurring system of oppression, the evidence of it became more apparent. COVID 19 showed multiple problems within the American healthcare system. African American people were dying at a rate of 1 to 4 of COVID 19 because of the existing health disparities. According to APB research, Pacific Islanders, Latino, Black, and Indonesian Americans all have a COVID-19 death rate double or more of that of white and Asian Americans who experience the lowest age-adjusted rates. One of the factors that cause this is the people with better insurance frequently get better health care, not to mention the low-funded hospitals in poorer communities. With Medicaid not covering everything and most poor minorities simply not being able to afford their medicines or the copay of their insurance, some people struggle to decipher between, are they going to pay their rent, are they going to buy their medicine, or are they going to get food? And medicine sometimes always gets put out of the mix and is medicine that they need. The number one cause of the people dying from corona is badly treated by underlying conditions seen in poorer people. Black people, by genetics, have higher incidences of blood pressure and diabetes, or sometimes both, causing some to struggle to manage their blood sugars. This connects to the fact that some doctors will prescribe people with diabetes or high blood sugars things like going to the gym, to work out, or only eating fresh fruits and fresh vegetables to manage their weight. If they can't afford to go to the gym and lose weight or to simply buy fresh fruit, how are they going to manage their condition? Causing this to be a never-ending cycle. Poor health care in minority communities started long before corona arrived in the USA. These communities are affected by the food deserts in poorer parts of the nation. However, in more affluent communities, the access to health care that is given to wealthier and healthier populations that has proven to be majority white Americans, which is not a coincidence. You can also see around 5 different grocery stores on one block in these neighborhoods. This shows that Black people with underlying conditions most likely can't take care of their bodies because of the resources to do so aren't around them. The issue of healthcare is significant in 2021 because 2020 opened the eyes of many people and showed that there is a great divide between various racial groups. Week 1 was about who had true power in the United States. I believe that the people that have true power are the companies and organizations that make large donations to the representatives and senators in Congress that control the U.S. government. I say this because upper and middle class, majority white people that are benefiting from the advantages are only accepting what is given to them. The government and the government officials are the ones that have the power to change the disparities in the healthcare system, schools, neighborhoods, and etc. I know this to be true because since the abolishment of slavery, there have been many policies and actions put in place to keep minorities where they are today, such as the making of the ghettos, by redlining in the Black communities, the 13th Amendment, which allows the government to incarcerate and enslave those deemed to have broken a law, and many wars on Native Americans to take their land and put them on reservations. If these problems were created by the ideas and ideals of the ones in power, then they can be changed by them as well. An example of a racial injustice in the healthcare system is from Monique Tello, MD, which she is telling a story of a patient she has. And she said, a patient of mine recently shared a story with me about her visit to an emergency room a few years ago. She had a painful medical condition. The The emergency room staff not only did not treat her pain, but she recounted them treating her like she was trying to play them. Like I was just trying to get pain meds out of them. They didn't try to make any diagnosis or help her at all. They couldn't get rid of her fast enough. There was nothing in the history that suggests she was a pain medication seeking person. She was a middle aged, church going lady who had never had issues with substance abuse. Eventually, she received a diagnosis and appropriate health care somewhere else. She is convinced that she was treated that poorly by the medical room staff because she was black. There are even doctors that will act in this manner and still feel that they are treating every patient equally. This illustrates some of the negative assumptions formed from racism by doctors, even when they are unaware of the discrimination they are adding to their patients' care. When thinking of this situation, think of this happening to many African Americans trying to seek help in a packed, stress-filled hospital during a pandemic. Another cause of the racial disparities seen during COVID-19 is essential workers. For most majority minority families, working from home was not an option, and not having a job was also not an option. Minority families were first to go to work because they were essential workers, and every day they had to risk bringing back COVID to their homes because they needed to provide for their kids or they needed to keep their home. Social media, in my opinion, has played a vital role in informing people of all ethnicities of the racial disparities in the healthcare system. On TikTok, a social app, there are videos of women telling stories from all around the world with the saying, doctors are to women as cops are to black men. A story I've seen recently that resonated with me the most is a story of a pregnant black woman that came into the hospital because she felt uncomfort in her belly. Upon minutes after getting checked in, she was rushed into the ER because the baby's umbilical cord was cutting off blood circulation. While in surgery, the lady said that she felt like somebody was laying on her chest and she couldn't breathe. She told the doctor, that happened to be white, that was operating on her repeatedly, and he did nothing. Finally, a black nurse came in for her regular checkup to see if she needed to help and heard the woman constantly saying, I can't breathe. The nurse immediately alerted the doctor that she could not breathe and she needs help. Still to this day, the woman believes that she would have died if it wasn't for her. According to statistics, the chances of a black woman dying from childbirth is 5 times higher than that of a white woman, but these statistics are cut in half when it's a black woman and a black doctor. This is similar to the statistic of black newborn babies being 2 times likelier to die than white newborn babies during delivery. According to a study published in July of 2020, when black doctors deliver black babies, their mortality rate is cut in half, especially in complicated cases. But no one knows why this is happening. This phenomenon is the reason why there is a separation between black and white feminist groups, because the two fights just aren't the same. To effect change in the structural racism in the healthcare system first has to be done by someone who actually cares about the people in that community, about the people in all of the different communities, because nothing can bring prosperity and nothing can bring everlasting change, everlasting growth, if it's not first foundation is done by someone who cares and someone who isn't just there for a title. Secondly, I feel that the way to conduct change is by first hitting the root of the issue, which is the medical care system, the medical school system. The medical school system, because there is a story of a guy also from TikTok who told his story, who was in medical school, and he said that there is a skin condition, and the way you can tell of this skin condition is if their whole body turns blue. And as the teacher was teaching, he said that the only way, this is like a dire condition, and the best way to tell that someone is having this condition is by looking at their body, and if their whole body turns blue, you know exactly what it is. Him being a dark-skinned male in this class, he was thinking to himself that if he had this skin condition, no one would know, because there was no way that he could turn blue. no matter what was going on. And he didn't want to be that guy and ask the teacher, what about black people, because he didn't want to stick out. He finally gained enough courage to ask, what about black people and what would that look like on them? And the teacher told him that you can tell in your fingernails, maybe sometimes your eyeballs. Without him asking that question, no one would have known. No one in that class would have known, and that answer would have never been answered. So, the healthcare system, to effect change, it has to be done at the bottom, because with those people, with the new doctors, they need to know that the standard care for white Americans and the standard care for minorities are different. Their bodies don't look the same and their bodies don't function the same, so it never should be a standard care. Secondly, I feel that there should be centers, community centers with workout areas and things like that, and also more grocery stores. I feel that health community centers should be put in poor neighborhoods, because some people can't afford to go to LA Fitness and some people can't afford to go to Planet Fitness. They can't afford to pay for these gyms and they can't afford to take care of their bodies, so they just don't. And I feel that people should have a free way to take care of their body, not only for people with underlying conditions, but also for kids, so kids won't just be everywhere. They can be in these community centers playing, and they can grow up with their body being in fit without just eating the chips and the corner store foods, well, small stores in their neighborhoods that only have chips. They can eat better. This is why I think that there should be grocery stores in poor neighborhoods, because where I'm from in Chicago, it's literally apparent. They're not even hiding it. You can go into a poor neighborhood and only see liquor stores and maybe a few churches, and that's it. When you go into a more high upper class, more of the whiter neighborhoods, you will see grocery stores lined up. You will see grocery stores lined up, every store you can imagine. For example, there is an Whole Foods, and they just opened up an Amazon, and Amazon and Whole Foods are in a partnership together. And for Amazon to open up a grocery store right across the street from a Whole Foods, I feel that Amazon could have went to any neighborhood. And there's a Mariano's literally down the street, and other grocery stores down the street from these places. That's not even a way to make money for those grocery stores. So I feel that the grocery stores should open up in neighborhoods where they need them, where they need the fresh ingredients, where they can't always go out to the better neighborhoods to get these better ingredients. I also feel that fresh food shouldn't be as much. There should be no reason why a salad is more than a cheeseburger. So of course, if someone can't afford fresh ingredients, they're going to eat a cheeseburger because the salad costs too much. So that also affects the health of Black or minority Americans, because they're going to go for the cheaper option if they have to. Secondly, I feel that the whole medical system needs to be modified. There should be insurance for all, and also there should be affordable medicines. For people who need medicines, there should be no reason why they have to pay. There should be no reason why they have to choose between paying their bills and buying medicine. They should already have medicine. There are places in other countries where getting on the ambulance is $13, $10, but here it's someone's whole month pay just because they needed to get on an ambulance. And that's not even covering their medical stay. That's not even covering the medical help. That's just getting a ride to the ambulance. There are people who are taking Ubers to the doctor because they don't want to pay the thousands and thousands of dollars of getting in an ambulance to go to the hospital. I feel that there are so many things and so many problems that affect the health of someone that needs to be changed in every community in America, not just minority communities. Also, I feel that the economic standing of a community should not factor in to the funding of a hospital or a school. Hospitals in more upper class neighborhoods have more funding because they are based on the economic standing of that community that they are in. There should be no reason that should happen. Every hospital should be the same, and every hospital, that should be the standard care, that every hospital has equal funding, equal supplies, equal materials, and equal staff. And that's it. Thank you so much.